Hi, Pierorazio from Johns Hopkins, presenting here some of our data regarding radical prostatectomy in men with positive lymph nodes. We queried our 30-year experience of radical prostatectomy and identified just over 500 patients who had positive lymph nodes at the time of prostatectomy, which is only about 2.5% of our entire cohort. We broke our analysis down into a number of regions. The first was just kind of looking at the prostate cancer and patient characteristics, and notably we found that the vast majority of men with positive lymph nodes have locally advanced disease, extraprostatic extension, seminal vesicle invasion at the time of prostatectomy, as well as advanced Gleason score. Second thing we did is we looked at time trends in the node-positive disease, and looking over 30 years, we found, as you would expect with increased PSA screening and better selection, decreased number of patients with positive lymph nodes over time. Also, we found decreased rates of extraprostatic extension, seminal vesicle invasion, and positive surgical margins following or at the time of radical prostatectomy. Third part of our analysis, we kind of looked more in depth at the lymph node dissection itself. We found a total median number of nodes to be 13, about 13 for the cohort. Positive nodes was about 1.7. And we were also able to map out the node dissection and metastasis, and we found for the patients who we could identify a dominant nodule, we found that about 20% would cross over to the contralateral pelvic fossa. And then finally we looked at our oncologic outcomes. We found that the vast majority of patients at 15 years are going to recur, at least biochemically, with only 7% free at 15 years. We did find, however, a durable 60% prostate cancer-specific survival at 15 years. And this was with about 50% of those patients getting hormone treatment. And basically, we found the main predictors in this cohort to be the number of nodes or the lymph node density at the time of radical prostatectomy, as well as other predictors like locally advanced disease or a high Gleason score. And really, the take-home message from this study is that we recommend a thorough bilateral pelvic lymph node dissection in all patients, especially those at risk for lymph node positive disease.